And I do expect many questions will be poised regarding what I would have done differently during the COVID pandemic had I been head of public health. The short answer is just about everything. There has been ample time to reflect on these questions. Upon retirement from Congress, I immediately returned to full medical practice, primarily treating COVID for the better part of now 4 years. It's been my observation that nearly every intervention attempted by government has been ineffective, counterproductive, and antithetical to the core principles of a free society. Mask mandates, lockdowns, forced closures of churches, schools, and businesses, coerced vaccinations, and suppression or intimidation of those who resisted are just a few examples of policies endorsed by the previous administration, which I opposed then and still oppose now. Not only because the policies were practically ineffective at achieving the stated goals, but primarily because they violate constitutional protections guaranteed to all Americans. Medical boards threatened providers who did not go along with the mainstream narrative. Pharmacists refused to fill valid prescriptions for repurposed medicines written by licensed providers. Federal authorities restricted the use of monoclonal antibodies just when we needed them the most. We were extremely fortunate to have Governor Landry as Attorney General at that time to provide a very strong counter to these tyrannical forces. As a primary care doctor, I supported him in his efforts then, and as Surgeon General, I support them now. This experience has brought into focus forces that have been progressively eroding the doctor-patient relationship for a long time. Collectively, we can call them third-party interests. Pharmaceutical companies, insurance carriers, and government are a few examples. Their primary interest is something other than that patient getting better. That is not to say they don't want the sick people to get better or that their intentions are all malicious, but only that their first goal by definition is not patient-centric. They want to sell a product, increase the stock price, push a political agenda. These third-party interests have inserted themselves between the doctor and the patient for their own benefit and to the patient's detriment. In many cases, it seems that they have hijacked public health to be their marketing legacy. A recent survey showed that trust in doctors had declined from 70% in 2020 to 40% in 2024. The cause is not a mystery. People have been repeatedly given bad advice, and they know it now. Public health was a major source of this bad information. In order to regain their trust, we will have to do something radical, and that is simply tell the truth.